Hi everyone, and thanks for joining us for Facebook Live on this Tuesday. My name is Regan Ennis, and I am here with
Joe Knapp.
and we're here at the Downtown Clinic when it's actually our newest clinic, number 20. We recently opened this last May. Awesome. That's crazy.
I'm pretty excited.
It is exciting. As you're all tuning in, we will get started here. Today we are going to be talking about chronic pain management. All right. Hopefully the internet is working well, Jesse. Okay, so Joe, can you tell me about some conditions that maybe you see frequently that people come in with chronic pain?
Yeah, so I use physical therapy as an effective treatment for lots of conditions, many chronic pain disorders, including amplified pain syndrome, fibromyalgia, complex regional pain syndrome, or reflex sympathetic dystrophy, depending on how old your professor was, and many other chronic issues. The three most common areas to have chronic pain in the body are the low back, the neck, and the knees. The neck and low back both consist of many joints and several different muscles that are going to attach through there, which makes them really complicated regions in the body. And then the knee is the largest joint in the body, so there's a lot of room for error, something to go wrong in there.
Sure. So all of those body parts are very different. So I understand that there's going to be different techniques that you can use on each body part and different services that we offer that could help. But could you name off a few different techniques that could be used to treat the chronic pain?
Yeah, so I use several different techniques. I use trigger point dry needling, which I know we've covered in previous videos.
For those who haven't watched, can you give a brief description of what that is?
Yeah, so trigger point dry needling is a technique in which we take a really thin monofilament needle and stick the needle down into a tight band in the muscle. And so if you think of a muscle at a cellular level, it should contract and relax and contract and relax. And then you get these knots in your body, and those look more like this, and it's kind of stuck in this almost contracted state or just really tight state. So we stick a needle down into that spot, and that causes a reflex where the muscle says, whoa, what is that? Get that out of here. And I'm a jerk, and I leave the needle in there until that twitch stops because that muscle has fatigued out. And that allows it to relax and return to its fully more elastic and more effective state. So that's been really helpful with a lot of different pain techniques because those knots can cause referred pain and all sorts of other dysfunctions. And then we use a lot of different manual techniques to help with any joint dysfunction that you might have. And that can also just be, maybe you just have a house full of kids or something that you're at home with all day and you don't have any time to relax at all, and here you are at your physical therapist and maybe he helps you relax a little bit. There's something pretty therapeutic about that. But it is really important also to exercise when you have chronic pain, which seems really counterintuitive.
Right.
It hurts to move. Well,
right.
We need to move. If you can get your body moving, 10 minutes of cardio exercise stimulates a release of endorphins, and that's going to help your body fight pain. And then if you can build that tolerance up to 45 minutes of just moderate physical activity every day for 4 to 6 days a week, your blood concentration of things like serotonin, dopamine, oxytocin, your natural feel-good hormones are going to build up in your blood, and that can be really beneficial for your mood, for your pain, and just your overall health in general. So exercise is really important. And then probably the most important thing that I do for my patients experiencing chronic pain is to provide education on how pain works in the body and how your body works when you're experiencing different pain disorders and when you're not functioning at your best.
So some of those techniques you mentioned will will give you more of an immediate relief, maybe not long lasting. So like dry needling could offer you some immediate relief within the next few days after a treatment. But you're talking about also offering education as a long-term kind of, not necessarily a fix, but a treatment for chronic pain.
Yeah. Well, so personally, I hate the term management, and not that you said it. You said management, but I don't like to tell you that we're just going to manage your symptoms, because that to me sounds like I'm just going to, give you something for every time your symptoms come up.